Hi, my name is Dr. Julia Hoffman, and I am Teladoc Health's head of mental health strategy. I am also a licensed clinical psychologist here in the state of California. I am so excited to introduce to you the product that I've been working on for well over a year, My Strength Complete. But before I do that, I want to say thank you to Salome and the whole Going Digital crew for having me among this esteemed lineup today. So with that, let's jump in. Probably since you're attending this conference, you have some idea of the severity of the mental health needs in this country. But just to get us sort of level set here, the American adult population was suffering through layers of epidemics related to mental health before COVID-19 ever came into our sight. We had a mental health epidemic, an opioid epidemic, a suicide epidemic. And then the COVID-19 pandemic on top of that added layers of incredible need, loneliness, and stressors we had never experienced before. If you look at the numbers before the pandemic, what we see is about 40% of American adults are healthy. They're resilient, they can cope with stress. Subclinical and preclinical folks make up 35% of the population. And that group are people who have stressors that actually can impact their quality of life, that can impact their ability to work, their relationships, their ability to meet their own personal goals. These are the folks who are not quite at the level of having a diagnosable clinical condition, but who actually may waver and may ultimately end up in that clinical bucket now and then. The clinical group with 20 to 25%, depending on whose numbers you're looking at, are people who have one or more diagnosable clinical mental health conditions. And the or more is important because it contributes to this concept of confusion around mental health. We know that you're almost as likely to have more than one mental health condition as you are to have one. So if we dig into that clinical population a little bit more, we can see that there are real human and economic costs to these conditions. They may sound familiar. Everybody's been a little bit depressed. Everybody's been a little bit anxious or a lot anxious during this past year. But actually, clinical conditions can drive really, really meaningful costs in a variety of ways. I have a couple of them laid out here, but these are far from the only ways to understand the gravity of the situation. We have mood disorders as the third most common cause of hospitalization. Suicide, even now with COVID-19 taken into consideration, is still the 10th leading cause of death in the US. For people with chronic medical conditions like diabetes, hypertension, chronic kidney disease, et cetera, the odds of having a mental health need are even higher. 1 in 3 people with a chronic medical condition actually have at least one diagnosable mental health condition. And again, this shows up as real measurable outcomes. 25-year life expectancy decrease for people with mental health conditions compared to those without. In the purple boxes, what you see is the impact of COVID itself. COVID seems to actually have some neurological impacts. About 1 in 3 people who have had it are indicating that they have neurological or mental health conditions following COVID-19. And coming up from that original 25% number, currently about 40% of American adults are saying that they have enough symptoms to meet the criteria for an anxiety or depressive disorder. It's pretty scary out there at this moment. And if you think mental health is broken and problematic, mental health care is really the problem that we're all up against. If you think about that 25% number that I just shared, the clinical group, that means that that's about 56 million American adults, 56 million fellow travelers on this road towards mental health care. But there are so many barriers along the way. I said that I'm a licensed clinical psychologist. To me, it's incredibly important to return to first principles when you're building technology. Understand deeply what the problems really are so that you can solve the right ones. It starts with health literacy. people do not know about mental health conditions. They don't know if they've actually got a real problem and therefore potentially a solvable, treatable problem, or if they're just stressed. Like, is everybody anxious, or is everybody suffering through a global pandemic? Should we treat it? Should we leave it? It's very hard to know, especially for the average layperson. Stigma is a massive barrier to people receiving care. I think it's probably the one that gets the most airtime. Stigma persists. We have seen that there has been an increase in utilization of mental health care across the board. Teladoc Health has seen a huge increase in our mental health visits. However, that does not mean that stigma is totally gone. Stigma is still alive and well. And when we're talking about real life clinics, you can even see that people are reticent to show up in a mental health waiting room. Some people don't even want to tell their spouse what's going on. Stigma is alive and well. We've got episodic needs. So I said mental health needs tend to be episodic rather than chronic. If you've got diabetes, you will have diabetes for the rest of your life. However, mental health conditions largely come and go, have spikes, have sort of exacerbations of symptoms. I've got a picture of a soldier here because that's in my history. I served veterans and active duty service members for a long time. But really, this applies to the American public broadly. Mental health needs are episodic and you have to catch them at the right moment. You have to strike while the iron is hot. So for those who are always waiting and imagining, I'll just wait for this deployment to end, for this horrible divorce to end, for this stressful job to end, for this pandemic to end, whatever it is, they may be waiting around for that spike to naturally come down. Sometimes it does, sometimes it doesn't, but mental health care needs to be right at the right moment. There's an incredible amount of noise in our system. We have so many different solutions available now in the form of clinical opportunities, in the form of digital opportunities and virtual opportunities. What we see, especially among young people, is they are more than willing to go see Dr. Google and Nurse App Store, but there's absolutely no way to differentiate in those contexts which one of these things is actually going to be helpful for you. Do you need a psychiatrist? Do you need a psychologist? Do you need a social worker? Do you need an app? What is it that you need? Do you need an app specifically for one condition? There are so many options now that actually it is making it nearly impossible to navigate the playing field. We have benefits folks who need to be weighing different solutions. Many of our mental health opportunities now to offer care actually come via employers, which means that we have benefits folks who are really in need of some amount of assistance in understanding what is actually helpful. They're not necessarily scientists, they're not necessarily healthcare workers or folks with healthcare experience, and it's really overwhelming. We hear a lot about vendor fatigue and just the desperation to understand what services are actually needed. There's a serious provider shortage in this country. 55% of the counties in the United States do not have one single licensed practicing mental health expert, which is just unbelievable to me. Imagine if you're trying to get care for your child, that is actually even worse. Finding a child therapist, a child psychiatrist, especially right now, is extremely difficult. Transportation, especially for older folks, can be a really challenging barrier to care. Mental health care requires you to show up in a place every week for some number of weeks or months. And that can be really difficult. It can also be extremely expensive. Mental health care is often paid out of pocket at this point for many people. It is not reimbursed in the same way as medical care is, and it can end up being extremely expensive. It ends up being kind of a luxury good for many, which is terrible. Location. So rural folks are really experiencing the shortages even more than people in urban city centers. There just aren't that many clinics, and traveling on a weekly basis or even a monthly basis to a clinic can actually be a pretty big hardship for people. There are many, many Americans who have jobs that are simply not flexible to let them out during regular clinic hours. And, wait times at this point in the US are averaging about 4 weeks for a therapist and about 8 to 12 weeks for a psychiatrist. And for some people, they just can't wait. These problems can get very acute, and the option to sit around waiting for a therapist to have an opening may not work for everyone. Now, let's say you make it all the way through all those barriers. That's about 22 million people that we've got there. So we've already lost quite a few people along the way. And then, once you get the journey to care, you need to go the journey through care too. So first of all, we understand that many therapies that are offered are not very high quality. Our friends, PCPs, primary care providers, actually are providing about 80 to 90% of mental health care in this country currently. And unfortunately, that's not often the highest quality care. And then evidence-based therapies. This is Dr. Freud. He does not do evidence-based therapy. But what you find is that many practitioners, when they close the door, they're doing something other than something evidence-based. So at the end of the journey through care, we have only 13 million folks left who've actually received any kind of beneficial, high quality care. So 39% of folks get help at all, and 23% receive adequate care. My Strength Complete was built specifically to address these critical barriers to care. So at the sort of top line item is that we are member and provider centered. Everything comes off of that, because we know that understanding the needs of our members is critically important to meeting them. And then also that our providers are in short supply. So among all of the companies represented here today, we are probably all pulling from the same finite set of providers. And so it makes sense to really understand what that provider experience is and how we can support them and optimize their work. And really it comes down to these 4 factors. We want to make sure that our product is easily accessible, that it's evidence-based and effective so that we don't have any quality of care issues, that it's comprehensive in scope so that we don't need a person to necessarily understand what their diagnosis is, what level of care they need, whether they need a therapist or a psychiatrist, anything else. We want to be a one-stop shop, the broadest possible digital front door to care, so that all you have to do is show up at our front door, and then we will take you by the hand and guide you through with our intelligent personalization, because a comprehensive scope is only more overwhelming set of choices if you don't also have all of the infrastructure to ensure that personalization is real, it's deep, and it's engaging. We cover every major clinical condition, as well as substance use conditions. And then we have tools for everyone. So at the low, healthy end of the spectrum, we still can serve up many, many thousands actually of activities for folks to do. So mindfulness tools, balancing intense emotions from dialectical behavior therapy, kind of inspired skills, managing stress. And then around in the outside circle, you'll see that we also have programs for sort of contextual or relevant other needs and conditions, including COVID-19 and dealing with the stress of COVID-19, or navigating the challenges of being a member of the LGBTQ plus community. So we have a huge amount of content covered. And we do this in the context of a full spectrum stepped care offering. So we didn't invent stepped care. However, what we've been able to do is build the first truly fully integrated stepped care solution, so that we have our virtual solutions and our digital solutions integrated so that we can have full flexibility and make the most effective and tailored program for any individual. At the bottom layer, we have our digital programs, from the smallest bite-sized sort of snackable items, the in-the-moment tools, so that you can cope in a difficult moment, whether or not you have a clinical condition. We have recommended digital content for you, and structured digital courses that allow a person who would like to go end to end in an experience and really resolve their symptoms along the way to do that in the context of obviously evidence-based paradigms. On the top end of our stepped care, we have remote licensed care, care with licensed providers. So teletherapy and telepsychiatry, therapy and meds. And this is all offered via the Teladoc network, but all takes place in the context of the single app experience so that you can have as easy of a journey through mental health care as possible. And then in the middle, we have our remote care options, which provide sort of a bridge between the digital and the licensed care, where we have guides who can help folks to navigate through the experience, keep them motivated, keep them engaged, help them with problem solving and goal setting, et cetera. We have crisis counselors who can do any kind of outreach for folks who may be in distress or in crisis. And then we have our new telecoaching program, which offers evidence-based interventions for subclinical and milder populations. You may have noticed that these different steps are actually the meaningful combination of the two companies that have come together just in the past few months, Teladoc Health and Livongo Health, which owned MyStrength. And between those two, and then plus the additional bridge steps in between, we have this incredible sort of scope and comprehensive opportunity to help people. But as I said, we really need to have that personalization engine under the hood. So we also are leveraging what was magic about Livongo in the first place, which was the AI engine you see here depicted as an infinity sign. It's driven by AI and machine learning to understand at the front end of the experience what this individual may need, and then to iterate constantly throughout the experience to ensure that they are getting exactly what they need. Now, I know as a clinician and as a scientist that there is nothing more important than personalization, because we know that 26% of the variance in outcomes in mental health care comes from the relationship between the mental health provider and the patient. The way that we can capture that in the context of digital care and virtual care is by providing an infrastructure and scaffolding that allows the person to feel understood at all times, like we are meeting their needs, like we have heard them, and like we are invested in following them through up and down this stepped care pyramid as they need, and that we're a reliable source of expertise in mental health. So our combined solution builds upon the proven performance of our respective solutions. So we're recognized as leaders in terms of satisfaction, clinical effectiveness, reduced costs, and we've proven our solutions at high volumes with a demonstrated ability to scale as our organization grows. So you see some of the numbers here. We have our first MyStrength Complete clients launching, and we are really, really excited to see great interest sort of across the span of different types of clients for us. It's not enough to just build an incredible stepped care model that's comprehensive, built into one tool, and that can be used by anybody across the entire spectrum of care. We are also deeply investing in innovations so we can address the most recalcitrant barriers to care. We have a process called macro personalization based on AI and machine learning at the front end of our experience, and then micro personalization throughout the individual's experience so that we can offer the right personalized plan for the individual member. And then because we know that health literacy and stigma drive lower utilization of mental health products, and that folks with chronic medical conditions are more likely to have mental health needs than those without, we have developed a whole set of systems for identifying mental health needs and then reaching out to someone at exactly the right time. So we can strike while the iron is hot, so to speak. And we can apply health signals for whole person care. So we can meet the needs of the whole person, regardless of whether they showed up to our clinic with anxiety, for a primary care visit, with diabetes, with some sort of a strep throat, whatever they show up with into the Teladoc system, we are prepared to guide folks into mental health care if and when they need it. So with that, I want to just say thank you so much again for having me. I'm so appreciative of the opportunity to speak here today and to hear all of the other speakers. I've been at this a very long time, and I can't, I'm being completely earnest when I say that this is an extremely exciting time that I feel like I personally have been waiting for 15 years, sort of accelerated by the pandemic. So there's a grain of gold in this sandbox. So thanks again, and please don't hesitate to reach out if I can answer any additional questions.